No two kids tell the story of how long-lasting the effects of C-section deliveries can be than two beautiful fraternal twins named Jordan and Tio. For Jordan's birth, everything went according to plan. At 36 and a half weeks, Jordan was head down, first in line, and born vaginally. But for Tio, things were a little bit different. Just before it was time for him to turn, he flipped back up into a breech position. And then after trying multiple maneuvers to get him back into a head-down position, he had to be delivered via a really quick emergency C-section. From that point forward, everything you'll learn about the science and reality of long-term C-section complications in kids became abundantly clear, tracking the first 12 months of these two boys' health. Jordan ate better, calmed and relaxed much more quickly, slept better, and was generally a very easy baby. Tio, on the other hand, had all sorts of difficulties with digestion, sleeping, soothing, and developing optimally. Tio was always smaller, tenser, more stressed, and struggled to gain weight as easily. He also had multiple inflammatory reactions like ear infections and other health struggles early and often. At around 6 months old, Tio began to suffer from infantile spasms. These are some of the worst things a parent can ever watch their kid go through. After 24 hours in the hospital and multiple drugs and injections given to Tio, he still did not respond. He continued crying uncontrollably and had spasms until he received a precise, neurologically-focused chiropractic adjustment to release his built-up tension and calm his entire central nervous system. It was remarkable to see the instant changes in Tio after that adjustment. His entire body relaxed, he stopped crying, and he came out of the spasms. Tio continued to get daily adjustments for the next 2 weeks and stayed at 3 times a week in an intensive pediatric chiropractic care for the next many months. In time, he healed entirely from his C-section complications and neurological injuries. So parents, if you're searching for answers for your kid's unique, perfect storm of health struggles, this video is for you. This is a time to trust your mom gut and get the answers you need. Health struggles are often tied together by way of the central nervous system. Tio and Jordan had the same genetics, diet, and environment in every way. So essentially, every other variable was controlled for these two. Meaning the only different thing is that Tio was born via C-section and Jordan wasn't. The physical trauma and neurological tension that C-section deliveries can cause is exactly what Tio was left with. That traumatic start to life left his central nervous system stuck in a perpetual state of what's known as subluxation and dysautonomia, both of which will be explained in detail below and linked to C-section complications. Most traditional doctors will blame genetics for a child's struggles. In turn, natural or holistic health websites and practitioners would blame toxins, dairy, gluten, and so forth. But with both of those being truly 100% identical in Jordan and Tio's story, it's clear to see how profound of an impact C-section deliveries can have on a child's life months to years later. There is certainly a noticeable difference in babies born via C-section versus vaginal delivery. In terms of most common early medical complications, things like breathing difficulties, low APGAR scores, and digestive distress are often seen early on in infants born via C-section. What we want to focus on in this video is not just the short-term medically documented effects of C-section deliveries on kids, but also the long-term effects. The first challenge that is an absolute, almost always overlooked and missed with C-section deliveries is the onset of subluxation in infants, cranial or their skull, and upper cervical or their neck regions. These are the most easily injured and altered areas for infants born via C-section, simply because at such a young age, they cannot protect those precious muscles, nerves, and joints that protect their brainstem and spinal cord from injury. The amount of force placed on a child's skull, neck, and brainstem during a C-section delivery is immense. It's far more physical and more pressure than would ever be allowed after the birth process. So while it may be life-saving at the moment, it's also life-altering from there on. We all know to protect the neck and hold the head for brand new babies and infants, but we've made it completely normal and okay to use the head and neck as a physical leverage, twisting, torquing, pulling during C-section and birth process simply to get the baby out. In addition to the upper cervical and brainstem trauma that can come from C-section deliveries, here are other long-term complications each parent deserves to know about. Digestive distress, like colic, constipation, eczema, that comes from missing out on optimal activation of the thoracic spine and neuromuscular systems that control motility, absorption, assimilation, and so forth for infants and children. Respiratory and immune compromise that can also come from not only the lack of motility through the ear, nose, and throat, lymphatic system, and lungs, but also from the disruption of the microbiome and the vagus nerve. Right here is an image of an electromyography scan or an EMG scan that we do in the office. This scan measures stress, subluxation, and tension on the nerves and muscles connected to the brain and brainstem, taken on an 8-year-old born via C-section. This child suffered from colic and recurrent ear infections as an infant and young child, and now struggles with ADHD, anxiety, and learning disabilities in school. The increased color pattern, or that green, blue, and red that you see in the cervical or neck regions, indicates increased stress, tension, and subluxation. These tension patterns are not just caused by poor posture or sitting at a desk for too long, as is commonly blamed today. Now, it's a real problem, but literally these problems from birth can persist and linger all the way back from injury and trauma to those nerves and muscles from the C-section delivery. When parents start to look for help healing their kids naturally and without drugs, we always encourage them to start in the same place, the nervous system. The nervous system is the main air traffic control system that modulates and controls each and every other vital system in the body, from the gut and digestive system to the immune system and the motor system, hormones, emotions, and so much more. Especially when you feel like you've tried absolutely everything, chiropractic is the final missing link. Nothing works well if the nervous system isn't working well first and foremost. Any motor tone challenges that your PT, OT, and speech therapist may be working with your child on may start with the tone of the nervous system and spinal nerves first. Any gut and digestive issues, such as food intolerances or allergies your child is looking to avoid, are all controlled first by the vagus nerve and autonomic nervous system. Any respiratory and immune compromise and chronic illnesses such as seasonal allergies, asthma, so forth, are all governed and modulated first by the vagus nerve and the autonomic nervous system. When we talk about primitive reflexes not being integrated and having some struggles with eye movements, these are all governed by that vagus nerve and autonomic nervous system. No matter what you've all tried to help your child heal and improve, it will be enhanced when you add Neurologically-Focused Pediatric Chiropractic. Check out our website and give us a call to get your kiddo on the right track.